Welcome to the information seminar and the first of 5 sessions comprising the Mindful Buteyko Breathing course. Congratulations on taking the first step to control your health. In this session, we will cover the following topics: the history of Buteyko breathing in both Russia and in the West, my personal experience with obstructive sleep apnea, some significant statistics in relation to obstructive sleep apnea, the science behind Buteyko breathing, and finally an overview of the course that I teach. Konstantin Buteyko was a doctor from the Ukraine who became professor of medicine. In 1946, as a third-year medical student, Konstantin Buteyko was given a medical assignment to study and monitor the breathing of dying patients. He observed that as death approached, the breathing consistently became very deep and laboured. You may have heard of Cheyne-Stokes breathing, which is characterised by a gradual increase in the depth and sometimes the rate of breathing, followed by a decrease resulting in a temporary stop in breathing, called an apnoea. This pattern repeats with each cycle taking from 30 seconds to 2 minutes. This pattern of breathing has also been known as the death rattle. Buteyko was fascinated by this breathing pattern as he thought that breathing simply trailed off as death approached and eventually stopped. But it clearly didn't happen that way. He hypothesized that deep breathing may also relate to diseases, as people died from diseases. As a young doctor, one of his patients exhibited all the hallmarks of an asthmatic, yet he claimed that he had been diagnosed with malignant hypertension or very high blood pressure. Dr. Buteyko hypothesized whether the deep breathing that was typical of asthmatics and so pronounced in this hypertensive patient was not only an external sign of the disease, but the reason for it. On 7 October 1952, Dr. Buteyko personally experienced a hypertensive crisis. He suffered from very high blood pressure. The blood in his temples throbbed, and the back of his head felt like it was splitting. His pounding heart was in severe pain, as was his right kidney. He began to lessen his breathing, so that it was shallow. Despite wanting to open his mouth and take in great gulps of air, he restrained himself. He just breathed a little. A minute passed, then 2, then 3, before his headache began to disappear, and before the pounding in his temples ceased. The pain in his heart subsided, leaving him feeling wonderfully relaxed. His aching kidney felt as though it had been soothed. He deliberately took several deep breaths, and his symptoms returned instantly. He reduced the depth of his breathing, and the symptoms disappeared again. Professor Buteyko's discovery was that if we breathe more than is physiologically necessary, our respiratory system will not function efficiently. Professor Buteyko described the overbreathing as hidden hyperventilation. The over-breathing or hyperventilation has fundamental consequences for our health. I will discuss the relevant science at a later point. But if we want to normalise our breathing pattern, we need to re-educate how we breathe. It took until 1980 before Buteyko's medical discovery was accepted and endorsed by the Russian government as a mainstream form of treatment for asthma and other respiratory ailments. In 1990, the Buteyko method was brought to Australia by Sasha Stelmatsky, a Russian who trained with Professor Buteyko. Between January to April 1995, the first clinical trial for asthma sufferers was conducted at the Mater Hospital in Brisbane, Queensland. The results of this clinical trial were stunning. There were two control groups. The first group relied on their usual asthma medication, and the other group was taught the Buteyko method of breathing. Following the completion of the clinical trial, the Buteyko group had the following results, which were eventually published in the Medical Journal of Australia in 1998. An average 96% reduction in bronchodilator or reliever medication. An average 49% reduction in steroid or preventer medication. An average 71% reduction in asthma symptoms. There was no material change to the symptoms of those in the asthma group. In 1996, the Buteyko Institute of Breathing and Health was formed. Today, there are 29 members in 7 different countries. Another significant clinical trial occurred between 2001 to 2003, where Jill McGowan, a registered nurse and Buteyko practitioner, self-funded and led the world's largest clinical trial of 600 people in Glasgow, Scotland. Again, the clinical trial compared the effects of conventional asthma management with the Buteyko method of breathing. 384 people, or 64%, completed the trial with highly significant improvements. An average 98% decrease in asthma symptoms. An average 98% decrease in use of reliever inhalers. An average 92% decrease in use of preventer medication. This trial achieved greater results than the Mater Hospital clinical trial due to the length of the trial. The longer period gave more time for inflamed airways to heal and for the benefits of Buteyko breathing to appear. Despite the success and positive reaction from some doctors, the call was for more research. But it is very expensive to fund clinical trials, and you cannot expect pharmaceutical companies or manufacturers of CPAP machines to fund clinical trials. These companies, you will appreciate, are in the business of making large profits, treating people who suffer with the very conditions that Buteyko breathing controls. I believe that I suffered from obstructive sleep apnea, OSA, from my mid to late 30s, but severe OSA wasn't diagnosed until 2008, at the age of 48. Many people have OSA, but they're simply unaware of it. In my 30s, I would often fall asleep while watching television. When I was in my 40s, I was conducting and managing my own legal practice. I ran a busy practice, employing up to 6 professional and support staff. Occasionally, I fell asleep, just for an instant, at the wheel while driving my car. sometimes when my children were passengers. I fell asleep in my office at my desk to try and catch up on lost sleep. I was overweight, lacked energy, often felt breathless, and suffered constant headaches. I was afflicted by flu-type symptoms and had poor sleep. It was a crazy time, as I managed to survive on poor sleep while conducting my business, raising children, looking after sick parents, and maintaining a relationship. These symptoms or conditions were reversed in April 2010 after I commenced a Buteyko breathing course. I took 6 weeks to complete the course, as I could not afford the time from work to complete a course over 5 consecutive days. While it is preferable to complete the course over 5 consecutive days, it is possible, as I discovered, to complete the course over several weeks, but you must maintain a consistent level of commitment in carrying out the breathing exercises and in implementing the recommended lifestyle changes. Even though I was using a CPAP machine at the time of commencing my course, I stopped using it after the second night of breathing exercises. The quality of my sleep steadily improved until I reached a point where I only needed 6 to 6.5 hours sleep each night. Over the ensuing months, I noticed the following benefits. My energy levels had increased. I would wake up feeling refreshed. I lost almost 10 kilograms in weight. I was calmer and less inclined to feel stressed. I experienced a new sense of self-awareness and well-being. I rarely needed to see a doctor. Remarkably, I no longer suffered headaches. This photograph was taken 9 months after the photograph taken in the previous slide. In 2016, I was motivated to begin training as a Buteyko practitioner, or as I prefer to say, a breathing re-educator, because that is what many of us need to do. If we want to normalise our breathing pattern, we need to re-educate how we breathe. The health consequences of dysfunctional breathing are too serious to ignore, particularly as we age and our respiratory system exhibits signs of wear and tear from incorrect breathing. This is a checklist of the key indicators or parameters which are used by the medical profession to assess our health. Our pulse should be between 60 to 80 beats per minute. Our body temperature should be 37 degrees Celsius. The minute volume of breathing, or the volume of air that we breathe each minute, should be ideally 4.5 litres per minute, but definitely less than 14 litres per minute. Our blood pressure optimally should be less than 120 over 80. That is, the systolic pressure should be 120 at the most, and the diastolic pressure should be 80. Our blood pH level, that is the range 7.35 to 7.45. Otherwise, if it's outside that range, our blood pH will either be too acidic or too alkaline, with resultant health consequences. Our blood sugar level should be between 4 to 5.4 millimoles per litre after having fasted. If there's an increase in our blood pressure or an increase in our body temperature, then this has serious consequences for our health. But the quantity of air we breathe, or the volume of air we breathe, is often ignored by the medical profession. Years of research has established that the average volume of air breathed is 14 litres per minute, or 3 times the standard healthy rate determined by the World Health Organization of 4.5 litres per minute. Buteyko's scientific and medical contention is that over-breathing is the cause of many illnesses. By combining lifestyle changes and breathing exercises, we can improve our health. When I was suffering with severe OSA, I had difficulty accepting this proposition, as I was often breathless and struggled to get enough air. But how could breathing less help me? When you see someone having an asthma attack, an apnoea, or panic attack, they are certainly not breathing like I am now. Before we can appreciate how important it is to normalise our breathing, we must first appreciate the different compositions of air, both external to our lungs and within our lungs. Externally, the air we breathe is comprised of 78% nitrogen, 21% oxygen, and only 0.03% carbon dioxide or CO2. The only organ between the air and our blood is our lungs. Within our lungs, in the alveoli sacs, there is a different level of CO2. The optimum level of CO2 in the lungs is between 5.5 to 6.5%, whereas the level of oxygen is only 14%. It is here within our lungs where the exchange of blood gases takes place during the respiratory process. There is also extensive smooth muscle in the lungs. It's an enormous surface area built to accumulate the correct mix of gases. And the release of oxygen into the blood and to the tissues and cells happens when the mix is right. Buteyko breathing derives its benefits from the scientific theory known as the Bohr effect. In 1907, a Danish physiologist, Christian Bohr, won the Nobel Prize. He discovered that an adequate supply of CO2 is necessary before oxygen is released from the molecule oxyhemoglobin to our tissues and cells. There are millions of these oxygen-carrying blood molecules in our body. CO2 is not just a waste gas. We need at least 3% within our alveoli sacs. That is 100 times more than the amount of CO2 in the air. If we blow off too much CO2 when we exhale, it will adversely affect our blood oxygenation. To illustrate, look at what happens to us when we hyperventilate or overbreathe. Remember blowing up balloons for a kid's party or laughing so much that you felt faint? We become dizzy, lightheaded, and may experience tingling in our feet and hands. We can actually faint. When we overbreathe, our CO2 levels drop, which in turn restricts the ability for oxygen to be released to our tissues and cells. We become hypoxic. Our body, in response to a lowering of CO2 levels, compensates by stopping breathing, otherwise known as an apnea. And when our CO2 levels begin to rise, this will trigger the breathing mechanism. Our respiratory settings are housed within those parts of our brainstem known as the medulla and pons. This area receives information about blood CO2 levels and, based upon the information received, determines the response from the breathing muscles to either increase or decrease the rate and depth of our breathing. When overbreathing, the medulla is oversensitive to CO2, and you are forced to breathe sooner when your CO2 level is too low. You will breathe normally when your alveolar CO2 level is at 5.5%. Also, your respiratory settings will have accustomed to a higher CO2 level at this point. Professor Buteyko calculated that you can change the way you breathe by resetting the level of CO2, as it is the level of CO2 which triggers the breathing mechanism in your brain. To ensure that more oxygen is effectively released to our tissues and cells, we need to breathe less. The normal volume of air we should breathe while at rest is 4.5 litres per minute. However, breathing is of course relative to our activity level. By breathing only through our nose, we will breathe less, as our mouth allows a significantly greater volume of air into our lungs. Nasal breathing will also filter, humidify and warm the air so that our lungs do not receive dry and cold air. It also provides extra resistance, which serves to regulate our breathing, and also engages the diaphragm. Nose breathing allows both CO2 and a gas called nitric oxide, NO, to accumulate in our paranasal cavity. Why is maintaining an adequate supply of CO2 and NO important for our health? CO2 is the body's natural bronchodilator. blood vessel dilator, smooth muscle dilator, a primary regulator of our blood pH. It naturally relaxes the tubes and muscles in our airways and blood circulation system. If CO2 is low, the pH balance is affected. It can interfere with our metabolic processes and cause a weakening of our immune system. This can lead to allergies, colds, flu, viruses, and infections, which may lead to the development of tumours. CO2 is an important buffer in regulating the body's acid-alkaline balance. Nitric oxide has been called by scientists the third gas in our respiratory system. It has distinct functions for our cardiovascular system, our nervous system, and in the communication between the upper and lower airways. Like CO2, NO also enables hemoglobin to supply oxygen to the tissues. It increases cerebral blood flow and oxygen to the brain. It acts as an anticoagulant and enhances blood flow, hence its role in Viagra. It has been shown that the nasal NO concentrations are higher at lower flow rates. Therefore, it is important to breathe lightly and slowly to harness an optimum amount of NO. Insofar as sleep apnea is concerned, as NO is inhaled through the nose, into the throat, en route to the lungs, it plays a role in assisting the upper airway muscles to keep the airways open. The gas transmits messages between the nose, throat, muscles and lungs. It may be a fair question to ask, why not just rely upon CPAP to treat my sleep apnea, or puffers or Ventolin to treat my asthma? In answering that question, we must look at the CO2 levels when they are low, because at that time our body compensates by stopping our breathing or creating an apnea, or in the case of an asthmatic, constricting our airways in an attempt to hold on to CO2. This process allows the CO2 level to rise as internal respiration continues. The problem with the CPAP machine is that although it usually provides immediate relief, it perpetuates the problem of overbreathing. Similarly, Ventolin opens up the airways for an asthmatic, but it inevitably results in a greater use of the reliever Ventolin when the effects of overbreathing cause a constriction of the airways. By using CPAP, the forced unnatural supply of air into the airways can result over time in a greater pressure setting adjustment on the machine in order to service the sleeper's breathing requirements. These are all consequences of treatment which addresses only symptoms instead of the cause. The policy of the Buteyko Institute of Breathing and Health is for the person to continue taking medication or to continue using CPAP until their symptoms and tolerance to CO2 improves, and before the person is weaned off the asthma medication or weaned off CPAP. What if you have a blocked nose regularly? Even if your nose appears to be unblocked, you will still experience the benefits of this exercise. You can see the video demonstration in the following slide. Buteyko teaches us how to unblock our nose in 5 easy steps. First, take a normal breath in through your nose and let out a normal breath from your nose while keeping your mouth closed. Second, pinch your nose with your thumb and forefinger so as to stop any air escaping. Third, hold your breath for as long as you can whilst keeping your mouth closed. 4, while holding your breath, nod or shake your head to promote blood flow. And finally, when you can no longer hold your breath, inhale through your nose while keeping your mouth closed. Your nostrils will have dilated due to the accumulation of CO2 while your internal respiration continues. Any mucus will have been reabsorbed. Depending on the severity of your nose blockage, you may need to carry out this process 2 or 3 times. I'd like now to provide you with an overview of the Mindful Buteyko Breathing course that I teach. The course will teach you to overcome your symptoms by using the natural dilating effects of both CO2 and NO, nitric oxide. You will learn to prevent symptoms and attacks by normalizing your breathing and the CO2 levels in your body, thereby reducing the need for medication. Of course, any reduction of your medication needs to be approved by your doctor. You will develop an awareness or mindfulness of your breathing and how it affects your health on a day-to-day basis. You will retrain the brain's breathing center to accept normal levels of CO2, that is 5.5% to 6.5% air within the alveoli sacs within your lungs, thereby normalizing your breathing and restoring the correct balance of oxygen and CO2. This restoration optimizes your immune system and enables the body to heal. You will also obtain a greater understanding of not only your condition, but also other breathing disorders, and the effects that food and certain behaviours have on breathing. What I would like for you to take away from this information session is 3 strategies that you can implement immediately. Sleeping in the best position, in order of preference, is first on your left side, second on your right side, third on your stomach, and lastly, as a long last, on your back. If you're sleeping on your back, your mouth is likely to open and your breathing will deepen as the pressure on your internal organs stimulates you to breathe. Your left lung is smaller as it shares space with your heart. Lying on your left side actually stabilizes your heart. You will do well to remember that the left side is the recovery position. Sleeping elevated with 2 or 3 pillows. You can also prop up the bed with books or even bricks. Elevation gives you greater control over your breathing. It counters the effect of generally breathing deeper when we lie down. Always breathe through your nose. Be mindfully aware of your breathing during a range of everyday activities and in a range of different circumstances. For example, walking, talking, eating, yawning. Remember that nose breathing filters the air due to hairs and mucus, warms the air due to our blood vessels, and fights bacteria due to nitric oxide. If you implement these strategies, you should notice a small but important difference. We're now coming to the end of the information session, and I'd like to express my appreciation for you persevering this far. If the course is something that you don't think that you would be interested in at this stage, depending on your particular condition, you may wish to have a read of my book, particularly if you have sleep apnea or sleeping issues in general. There are many reviews that I have received in relation to my book, and I've selected 3 of the following reviews. The first review is from Dr. Jill McGowan, who conducted and self-funded the largest clinical trial that you'll recall listening to in Glasgow, Scotland, concerning the 2 asthmatic control groups. The second review is from Patrick McEwen, the world-renowned author and Buteyko practitioner, and his best-selling book, The Oxygen Advantage, may be a book that you have come across. And finally, there is an extract from a review from Paul O'Connell, who is the Chief Executive Officer of the Buteyko Institute of Breathing and Health. And I underwent training with both Paul O'Connell and Patrick McEwen for my certification as a Buteyko practitioner, or as I say, breathing re-educator. So have a read, and the book is available on my website, either in ebook format or paperback.